It's Miss Anna with CapK's CalWorks Home Visiting Program. Can't see all of my sign. And we are back for another before baby arrives first trimester video for all my pregnant mommies. So let's see. Our first handout, it is for trimester 1. However, it can be used to see what a healthy weight is throughout pregnancy. So, ideal weight gain during pregnancy. Your breasts are going to gain up 1 to 2 pounds. Baby will have 6 to 8 pounds. Your placenta is another 1 or 2 pounds. Your uterus is going to be 1 to 2 pounds. Your fluid is going to be 2 to 3 pounds. Your blood, 2 to 3 pounds. And then your protein and fat storage, 8 to 10 pounds. Your body fluids, 3 to 4 pounds. So if you're gaining weight, that's where all the weight is going. All the nutrients your body gets comes from the foods you eat. Your newborn baby is growing every minute and needs a steady supply of nutrients. Good nutrition during pregnancy means eating twice as well, not twice as much. The amount of weight you should gain depends on your pre-pregnancy weight. If you are overweight now is not the time to diet. So pre-pregnancy weight, average weight 25. If your average weight, the ideal weight gain is 25 to 35 pounds. Underweight, 28 to 40 pounds is what you should be gaining. If you're overweight, only 15 to 25 pounds. And if you're obese, 11 to 20 pounds is what you should be gaining. Check with your doctor or midwife to find out how much weight gain is right for you and your baby. Not gaining enough weight can result in high risk for your baby being born too early and too small. If you are underweight, you will need to gain more weight than if you are overweight. Talk to your doctor. Gaining too much weight can cause high blood pressure, gestational diabetes, backaches, varicose veins, and other health problems. That baby may become too large to deliver vaginally. So in that situation, you'll have to have a C-section. So if you're not wanting a C-section, you want to make sure you're eating twice as well, not twice as much. Okay. The next handout 17, why prenatal care is important. This is what it looks like. It's important to get early and regular prenatal care even if you're feeling fine. Why? Because most problems, if caught early, can be corrected before they become serious. Going to your doctor or midwife regularly may prevent your baby from being born too soon or too small. Even if this is not your first pregnancy, regular prenatal care can help you and your baby stay healthy. Your doctor will let you know how often you'll be seen. Typically, visits are once a month until the last trimester, and then you'll go more often. However, if there is some kind of issues, then you will go more often. But again, that is something for your doctor to let you know. That's not something that we can tell you. So just make sure that you speak to your doctor. In the box right here, this is where you would put any questions you may have. That way you don't forget. Sometimes we get nervous, and so we often forget the questions that we originally wanted to ask. So if you write them down, you can ask for this handout through your visitor, or just write it down on a piece of paper and make sure that you have it so that when you go to your next visit, that you are, sorry, I gotta fix my sign, that you're ready to ask those questions. Our next one is about changes during early pregnancy. So not everybody has the same symptoms. However, these are things that in the situation that you have any of these that you could do. So nausea or morning sickness, some people have it at the beginning. Some people have it throughout, some people don't have it at all. Some people don't get it till later on. But these are some things that you can do to help with it. Before getting out of bed, slowly nibble some crackers or dry food. Wait an hour after getting out of bed before drinking any liquids. Eat small snacks throughout the day instead of big meals. Drink lots of water between meals rather than drinking with meals. Avoid greasy, smelly, or spicy foods. Um, Suck on hard candy or chew gum. Ask your doctor, midwife, if you need medication. So these are just some things, some examples of things that you can do, not necessarily what you should do that's going to make you better. It's just some suggestions that you can try. Everybody is different. So something that may have worked for me may not work for you, but might work for somebody else. Feeling lightheaded or dizzy, stop what you are doing and lie down. Change from laying to standing slowly. So if you're feeling lightheaded or dizzy, you want to make sure that you try those two things. Sore breasts, that often happens because you're growing, baby's growing, as we heard in the last one. Your breasts are going to increase a pound to 2 pounds depending on where you're at, and you can start to feel those changes early on. So you want to wear an athletic or support bra, even to bed. I know a lot of times we don't like it, but if they are hurting, you want to make sure that they have that support. And then soak in a warm bath. Feeling tired, try some gentle exercise. Don't resist sleep. Rest 10 to 15 minutes several times a day. And then needing to urinate frequently, don't try to hold it and don't cut back on liquids. Continue to drink plenty of water or juice each day. Expect to get up at night to urinate. It's a normal part of pregnancy. So make sure you're not holding it or trying to drink less to avoid having to go as much. And our last one that we're going to go over, I know lots of information. Again, if you want any of these handouts, please ask your visitor so that we can provide them to you. Preventing birth defects. Not all birth defects can be prevented, but there are things you can do to decrease your risk. Every 4 minutes, a baby is born with a birth defect in the United States. That's not to scare you. That's just to make sure that you're aware of what's going on and making sure that you're keeping those prenatal visits so that you can stay on top of and make sure that your baby is healthy. Choosing a healthy lifestyle, get early and regular prenatal cares, take prenatal vitamins, especially the folic acid, eat a well-balanced diet, and maintain a healthy weight. Exercise and get plenty of rest. Avoid harmful substances. Don't smoke and avoid secondhand smoke. Don't drink alcohol. Don't take medicine, prescriptions, or over-the-counter without talking to your doctor. Don't use marijuana and other street drugs. Now, I am not a doctor. This is what the paper says. However, if you were smoking prior to getting pregnant and during pregnancy, you need to speak to your doctor to see what your next steps should be. I know it's tough for you guys to just go cold turkey, regardless if you're doing any of these substances, smoking, alcohol, or medication or marijuana. So you want to make sure that you are truthful with your doctor. They should not be judging you. They're there to help you, but they have to know everything in order for them to give you the information that you need to make sure baby is healthy. Prevent infections. Use condoms to help prevent STIs. Wash your hands often with soap and water. Avoid being around people who are sick, and ask your doctor about group B strep. If your baby is born with a birth defect, talk with your doctor. You will have many questions about your baby's special needs, and it's okay to feel worried for your baby. Going back to the prevention, using condoms. If you are with multiple people, or you're unsure if your partner is, oh, there goes my sign. If your partner is being faithful, please make sure you're using a condom. That protects you, that protects baby, especially right now. If you need condoms, please contact your visitor. I do have some that we can provide for you guys. But right now, with everything going on, we're limited to our resources as well. But if that is something that you may need, please reach out to us and let us know. You should be washing your hands anyways with everything going on, but just make sure that you continue to do so at least 20 seconds in warm water. And as always, if you have any questions, comments, or concerns, please, please, please reach out to your doctor. If you don't feel comfortable by yourself, find somebody who can go with you, who can support you in asking those questions, because the number one thing that we want is for you and baby to be healthy and safe. That is it for today for our pregnancy prenatal trimester 1. Here are again our 4 lovely handouts. If you would like them, please let your visitor know. Have a great day.